Welcome to the third Brain Innovation Days virtual event. You're over 200 people that have registered for this particular event.
One of the major aims of these days is to create synergies and showcase the importance of innovation in the brain space.
What we could see with COVID-19 was a great success of health research and health innovation.
What we have learned is really the power of science and the power of open science, of collaboration, of collective intelligence.
Now that the pandemic is proceeding, it is clearly that some outpatient services have been affected even more than we were expecting.
I think that there are distant places where we would have needed telepsychiatry in the past, and now with this push we are able even to reach more remote areas.
I think that the neurologists have shown quite a lot of agility and flexibility in adapting, above all, to the first wave.
My care has been somewhat disrupted. Everything has moved online, and I'm at a situation where I'm now getting very used to it being online and understanding that it can actually be somewhat more of a benefit to me.
Obviously, it's not only a pandemic that has affected the bodies, but also the mind and the overall well-being of the people. And what we've seen, it's despite that epidemiological data are still to be harmonized, they all go toward the same direction. That is an increased risk for disorders such as anxiety and depression.
We observed a greater use of a more adaptable and innovative approaches, such as innovative clinical trials, use of remote monitoring and teleconsultations that allowed us for the continuity of care, for the continuity of research, but also of clinical trials.
To show you a concrete example of something that's been possible really because of COVID, something we wanted to do before COVID, but has been possible because of COVID.
And the only way that we're going to be able to deal with these increased issues and also capitalize on the opportunities that exist for a greater recognition of the importance of brain health is if we find ways of supporting fundamental research in Europe to a greater extent.
Huge impact. There are some negatives, but I would also say there's some positives that have come out of all of this.
No, definitely. There is a lot to harvest upon, and a clear message to you all who are tuned in. Stay tuned and continue to follow us.